Hello friends, my name is Dr. Varun Nivargi. I am a consultant interventional cardiologist practicing in Kothrood area. I have my clinic in Kothrood in Mayur Colony. Today I will be discussing some important topic with you, that is ambulatory blood pressure monitoring and its importance. Ambulatory BP monitoring provides a 24 hours account of the patient's state and is useful for diagnosing primary and secondary hypertension and differentiating it from the white coat and masked subtypes. It is accurate in predicting the risk of cardiovascular disease and mortality. BP level measurement using home or ambulatory BP monitoring is recommended in patients with office BP classified as high normal BP or grade 1 hypertension, that is systolic 130 to 159 mm of mercury and or diastolic 85 to 99 millimeters of mercury. Ambulatory blood pressure monitoring provides the average of BP readings over a defined period, usually 24 hours. The device is typically programmed to record BP at 15 to 30 minutes interval, and average BP values are usually provided for daytime, nighttime and 24 hours. A diary of the patient's activities and sleep time can also be recorded. A minimum of 70% usable BP recordings are required for a valid ABPM measurement session. ABPM values are on average lower than office BP values, and the diagnostic threshold for hypertension is more than 130 by 80 millimeters of mercury for 24 hours, more than 135 by 85 millimeters of mercury for daytime average, and more than 120 by 70 millimeters of mercury for nighttime average. Advantages of ABPM are better predictor of hypertension-mediated organ damage than office BP. 24 hours ambulatory blood pressure mean has been consistently shown to have a closer relationship with morbid or fatal events, more sensitive risk predictor than office BP of CV outcomes such as coronary, morbid or fatal events and stroke. Can identify white coat and masked hypertension, stronger prognostic evidence, nighttime readings, measurement in real life settings, additional prognostic BP phenotypes, abundant information from a single measurement session, including short-term BP variability. Disadvantages are expensive as sometimes limited availability, can be uncomfortable. ABPM has become an indispensable tool in the diagnosis and management of hypertension and its therapy. Recent guidelines from ESC recommend that diagnosis of hypertension should be based on repeated office BP measurements or ABPM if economically feasible. Analysis of various indices on the ABPM graph such as hyperbaric index, diurnal index, dipping and other indices can provide useful information about the prognosis of diseases such as hypertension, diabetes, CKD and so on. It can also be used to monitor the therapeutic efficacy of antihypertensive treatment. In addition, ABPM is the single most effective tool to diagnose white coat, masked and nocturnal hypertension and can help direct the treatment in such patients when required. Overall, ABPM readings can guide towards the prognosis of an underlying organ damage and can be a useful predictor of cardiovascular risk. So this was in short some information about ambulatory blood pressure monitoring. Thank you.